Well, now it's time to talk about advanced ovarian cancer, and we have the results in from the SOLO1 trial, and here with me is one of the co-authors of that particular study, Dr. Susana Banerjee. Hello to you.
Hello.
So what was the trial about?
So SOLO1 is a landmark trial, and I really believe it's going to have a fundamental shift in the way that we treat women with newly diagnosed ovarian cancer with BRCA mutations. So the SOLO1 trial is a randomised phase 3 double-blinded study of maintenance PARP inhibitor in the frontline setting. This is the first trial of its kind. And in this study, 391 women were enrolled and were randomised in a 2-to-1 fashion in order to either receive Olaparib in the maintenance setting or placebo. So this was after their standard of care surgery and carboplatin and paclitaxel-based chemotherapy. So the primary endpoint of the trial was progression-free survival, and the trial met its primary endpoint. And what's astonishing and really exciting, outstanding results is that the hazard ratio was 0.3 in favour of Olaparib. So that means there was a 70% reduction in the progression-free survival time improvement, basically a 70% improvement compared to placebo. And we haven't seen those kind of results in the frontline setting. And the significance of this is that we know that PARP inhibitors like Olaparib, Rucaparib and Niraparib have activity and have changed standard of care for women with relapsed ovarian cancer. But now this is the first trial showing that there's a benefit for women having this in the frontline setting. And the benefit and the potential benefit of the frontline setting is that that's where we have the potential to increase cure rates. Now we need to wait for the overall survival data, and that will take some years. But this is a real change for women with BRCA mutations and emphasises and highlights the need for women to access BRCA testing.
And you're saying it's practice changing, so what will that mean?
So I very much hope that after these results and the publication that I'm privileged to be a co-author on in the New England Journal of Medicine will come out today, and I very much hope that communities, patients, regulatory authorities and approval agencies, that will be the next step so that women can access this drug, and that's the theme of ESMO 18. So I'm very pleased to be the track chair for gynecological cancers with these amazing results being presented at ESMO 2018.
And I suppose you'd really like to get on and get this drug out there and used in practice, but we have to go through this process, and does that take a long time?
Well, I think things in general have sped up over the years. Olaparib is licensed in the relapse setting, and so we do need to present the data to the relevant approval authorities, and hopefully there will be a change quickly for our women with ovarian cancer. I think the next steps really are to see if activity of PARP inhibitors go beyond women with BRCA mutations, so similar to what we're seeing in some of the trials in the relapse setting, and that will be one of the next steps.
Fantastic. Thank you so much for coming in to tell us all about it.
You're welcome.